It can even aid in weight loss and weight management. There is another article where the research revealed that people who were deficient in vitamin D3 had a greater risk of becoming obese and developing complications related to obesity. So, not only a greater risk of developing obesity, but a higher incidence of complications once they were obese. It can lower the risk of rheumatoid arthritis, a chronic inflammatory disease of the joints, often have very low levels of vitamin D. Rheumatoid arthritis is classified as an autoimmune disease, and the immune system reacts to the lining of the joints as if these proteins were foreign substances. And this leads to inflammation in the joint, which causes the stiffness and the pain and the reduced mobility. So, since one of the main vitamin D benefits is to help maintain the immune system and ensure that it's properly function, it makes sense that a deficiency in this vitamin could lead to the development of rheumatoid arthritis, or at least kind of accelerate the time frame for the onset of rheumatoid. So, by raising your vitamin D3 levels, there's a chance you could reduce the severity and onset of this disease and potentially even other autoimmune diseases. It lowers the risk of type 2 diabetes. This has been well researched, and there is a study below that confirms that there is a link between D3 deficiency and the body's resistance to insulin, which is type 2 diabetes. By overcoming insulin resistance, you could potentially prevent the development or the further exacerbation of type 2 diabetes. You see, the cells in the pancreas that are responsible for secreting insulin, the beta cells and the islets, as a result of not getting enough sunlight, reduce the secretion of insulin from the pancreas, which creates insulin resistance and affects how the body responds to glucose.